Hello, welcome to MedZone by Dr.farjana Afrin. Today my video topic planes, axis and movement. In this video, I am going to describe about some basic planes related with that axis and movement on different plane and axis. So let's start. We already know what is anatomical position. So on relation to the anatomical position, we can divide the body by different imaginary flat plane. So plane is a flat surface. So let's start. Number one, median or mid sagittal plane. We already know what is the meaning of median. Median means just through the middle, or we can say center of the body part. So median or mid sagittal plane, a vertical plane which is passes through the center of the body and divided the body into two equal half. What are the equal? Right and left. This is median or mid sagittal plane. The second one you can see sagittal plane. It's also a vertical plane and it will be parallel to the median plane, but it will be not divide the body into right and left half equally. Okay, there will be not equal division. There will be not equal division of body. The third one you can see paramedian plane. It's also a sagittal plane, types of sagittal plane which is close to the median or mid sagittal plane. There are two more also plane. One is coronal plane which is vertical plane and right angle of the median plane. Then transverse plane or we can say horizontal plane which is perpendicular to the median or coronal plane. So let's start to describe about this all. On screen you can see, we can denote it figure A, then B, then C. Let's start one by one. So first is the mid sagittal plane. Mid sagittal plane, it's run from front to back and even from top to bottom also, and just through the center as it is passing. So it divided the body into two equal half, right half and left half, for example. So if one more parallel vertical line I am drawing which is close to this mid sagittal plane. So what will be the name of this one? It should be the paramedian plane. And if one more also vertical plane I draw which is also parallel to the mid sagittal plane, but it is little bit far away from the mid sagittal plane, can say this is called sagittal plane. Next on figure B we can see horizontal plane. Horizontal plane, it's passing from side to side and from front to back, and it divided the body into two upper and lower part. Then figure C we can see there will be frontal, or another name of this is coronal plane. So in frontal or coronal plane there will be the imaginary plane which is running from side to side and concurrently from top to bottom. So here when we see the top to bottom and from side to sides running, the body is dividing into two. One is front and another one should be back. Other than this screen showing planes, there is one more also which we are seeing, it is called oblique plane. Oblique plane is also considering. In oblique plane we will see the plane is passing from any one side to another sides, either from right to left, and divided obliquely the body. There is one more plane also we are saying, it is called cardinal plane. If any plane traverse through the center, we will see it is called cardinal plane. Interestingly, cardinal plane can be coronal, cardinal plane can be sagittal, cardinal plane can be transverse. So if it is coronal, cardinal coronal. If it is sagittal, cardinal sagittal. If it is transverse or horizontal, we can say cardinal transverse plane. On screen you can see when the sagittal plane, more accurately we should say mid sagittal plane, just through the center passing, I will say it is called mid sagittal plane or cardinal sagittal plane. Then transverse plane equally dividing the body by going through the center, we will say cardinal transverse plane. And coronal plane just through the center and again equally dividing front and back, we will say it is called cardinal frontal plane. Now, what is the use of this plane? By using these planes, actually radiologically we are seeing the different sections of our body parts. On screen you can see the person is lying down on his or her back and the image are taking on different plane: sagittal, coronal, axial, or we can say transverse. So on screen you see axial, or we are saying it is called transverse plane, the image has taken, and here we can see the ventricles, the sulci and the gyri. On sagittal planes, as it is passing from front to back, we can see the more defined parts related with the brain here. These are again sulci and gyri. This is corpus callosum. This is cerebellum, midbrain, pons, medulla oblongata. This is the ventricles, lateral ventricles, and third and fourth ventricles also. On coronal sections, here also we can see the ventricles, the wide one, then the sulci and gyri. Internally some structures which are depend on brain. This is corpus callosum again and hypothalamus and part sections related with the internal capsule. So, plane mainly in radiological anatomy we are using. Next, we will be discussing about the axis of the human body. Actually, what is axis? Axis is a line which intersect the plane. So, we know what is plane and what are the plane. Now, axis will be a line which will be intersecting the plane and movement will be always occur along the plane. So, on screen you can see we can denote figure A, figure B and figure C. It is showing the basic three plane. So, sagittal plane. Let us start. Sagittal plane, we will see the line is passing from one side to another side. And of course, in sagittal plane, the axis should be frontal axis. So, if it is frontal axis, what are the movement should take place? The movement should take place will be the flexion and extension, dorsiflexion and plantar flexion. In frontal plane, the line will be passing from front to back, that means sagittal axis. So, in sagittal axis, the movement should be on frontal plane, that means adduction, abduction, lateral flexion, inversion, eversion, radial deviation, ulnar deviation. Even for a scapula also elevation and depression. On figure C, in transverse plane, we can see that the line is passing vertically. So, transverse plane, the axis is vertical axis. So, on transverse plane, movement will be rotational movement. Now, let us summarize all the plane axis and movement. So, we know the first plane we described, sagittal plane. So, on sagittal plane, the axis was frontal, or we can say coronal also. So, this is the axis. So, in this axis, what are the movement will be take place? Mainly we have to remember flexion and extension. There is two more flexion also in ankle joint. One we are saying it is called dorsiflexion another one it's called plantar flexion. Number B, we can write about frontal plane, frontal or we can say coronal. So, in frontal or coronal plane, the axis should be sagittal axis. And what are the movement here will be adduction, abduction, then lateral flexion of the body, trunk especially, lateral flexion, I am writing in shortcut. Then in ankle, inversion and eversion, radial deviation and ulnar deviation also. Radial deviation and ulnar deviation. Now the last one is transverse plane. Transverse plane, the axis will be vertical, and we know in vertical axis the movement is rotational movement. So it can be external rotation, it can be external rotation, it can be internal rotation, it can be supination, it can be pronation. So that's all about the plane and axis in relation with that different movement. Now we are going to discuss about the movement. So on screen you can see there are different movements image. Let's start with flexion. So the first is flexion. Flexion can happen in trunk, flexion can happen in limb. So when the movement of the trunk in sagittal plane bending forward, that is called flexion. And in case of limb, we can here describe in shoulder joint if we think movement of the limb forward, that is called flexion of the shoulder joint. In case of hip, again limb is moving forward, that will be the flexion of the hip joint. So movement of the limb forward, it is flexion. There is one more half also of the definition of the flexion of limb, fold towards the trunk. In case of knee joint, the limb is fold backward toward the trunk. This is flexion of knee joint. Then lateral flexion. Lateral flexion, movement of the spine in one sides deviating the body. It is called lateral flexion. Next, dorsiflexion and plantar flexion. Movement towards the dorsum of the foot is the dorsiflexion. Movement toward the sole of the foot is the plantar flexion. In ankle joint, there is no extension as we said. Then flexion opposite will be the extension. What is extension? Straightening of the bending trunk, or we can say the spine. So straight, bend from bend it is getting straight, it is called extension, or bending back, it is also extension in case of trunk. In case of limb, again straight or bending back, it will be the extension of limb. Now after the flexion extension, we are going to discuss about the adduction and abduction. Add means adding. So adduction, movement of the limb toward the median plane is adduction, away from the median plane is called abduction. Adduction and abduction can be also in finger. In that case, we have to remember movement of the finger towards the center axis, we are saying adduction. Away from the center axis is called abduction. Then we will be asking what is central axis. You have to remember in case of finger movement, the central axis will be upper limb, we can say middle finger. Then this adduction and abduction also we can use in movement in wrist area toward the ulnar side, it will be the ulnar deviation, and toward the radial side, that will be the radial deviation. Then rotational movement. We know rotational movement happen along its own longitudinal axis when the movement take place. If externally, then external rotation. If internally towards the body core, we will say it is called internal rotation. External and internal rotations, rotation movement, one more rotational movement is also there, that is called, we are saying supination and pronation. So pronation, when the hand moves alone with the radius, so the palm faces dorsally, or we can say posteriorly, that is pronation, and in supination it will be the opposite act, and it will be in the anatomical positions, returning the palm of the hand, that is supination. Then protraction and retraction. Very good example we can give on scapula and mandible. Protraction, movement of the bones forward. In pushing action time we are doing like that. Movement of the mandible forward, that is the protraction. Then when it is moving backwards and in its normal position, we can say it is called retraction. Retraction of the scapula, retraction of the mandible. Thank you all.